day 3, which is completed of my home IVs. Doesn't mean my whole therapy is finished. It just means I've completed day 3. I'll let you know where I am with things. Day 1, I didn't feel too bad. Day 2, I sort of started feeling the effects of the antibiotics and the infection. And by day 3, which is today, I'm just going to put do not disturb because the notifications come through. By day 3, I started to feel more tired. I felt as if the antibiotics were doing something, but as if the bug was trying to multiply. So you have this weird kind of feeling throughout the day. You feel like the antibiotics is doing the job, and then you'll have something that feels like it's not doing its job. And I just think it's how clever the bug is, the bacteria is, in the way it's trying to multiply, not multiply, and give resistance to the antibiotic. And I think we see this throughout the first week when we're on these IV antibiotics. I think we have fluctuations where we feel like, right, we're over it, and then we have a dip, a curve, and it goes like this. And the longer that we are on antibiotics, the same antibiotics, the longer it takes us to feel better during the cycles. Sometimes it can take the complete course, and then it could take a week after, maybe 2 weeks after, so we feel like we've got the benefits of being on the medication. Like any kind of therapy, it does take a lot out of you. You'll you'll look at yourself before treatment, where you just had the infection, and then you'll look at yourself during treatment with the infection, and you can see that you're looking a little bit haggard, drained, pale, lethargic, and I would say it gives you brain fog, where you're not as alert. You're not really there. I mean, you can do basic stuff, but it's like communicating. You'll see on this video, I've made a little bit of mistakes with my wording, or try to get it out. So yeah, I just think it's just side effects of medication, really, and just feeling shit in general. But yeah, it's not been my worst cycle. I've gone into this one probably at the right time for needing antibiotics. Usually, sometimes you're waiting a while, but this time I think they caught the infection at the right time. So that's good for me. It means that I should feel well within a couple more days. Today's been my best day, which is day 3. And usually that's with any antibiotic. By day 3 you should start picking up, and if you haven't picked up, there's a reason. Maybe it's the wrong antibiotic to treat the infection, or maybe it's resistant, things like that. But meropenem on the whole is the Ferrari of antibiotics. It's the go-to. It kills, I won't say it kills all bugs because it doesn't, but it kills the majority of bugs that bronchiectasis patients, cystic fibrosis patients get. So it's really good. And it can be given in the community because we have access to nurses AM to PM. And it was quite a late one today. It never goes like clockwork, so sometimes you'll think you'll get an early morning visit, and then it'll be followed by 8 hours apart because that's how long you have to wait. But tonight it was getting on about 7 o'clock, and yeah, it's a bit crap, I suppose. But it could be a lot worse. You could be in hospital getting your medication. Hi there, AUKF. I think I seen you on yesterday's. So yeah, I've not been myself. And I will mention that when I am on this medication, it really dries your skin out. You are supposed to drink a lot of water just to keep hydrated in general, but I always get like itchy, so I've tried to put some kind of cream on my beard, like side of my head, eyebrows, and it's just become like some kind of skin problem during the antibiotics. And sometimes before the antibiotics, I think when I've got an ongoing infection, I think that my body is giving me signals. We talked about signals before. That can be, a wheeze in the chest pain, green phlegm, changing mucus. But I think this time it's almost like I've got an allergy where I feel like I need to itch more, if that makes sense. So maybe the body's telling me something's not right. It's having an allergic reaction maybe to the infection kind of thing. So it's quite interesting that. All right there, mate. All right, Ben. Bungworm. I don't know what that is, mate, but thanks for coming along, Ben. Do you like get well? I don't get hives, mate. No, I know a person who does. There's a tablet called citalopram for mental health, depression, and it's a shame because it's supposed to be a really good tablet. So citalopram, so you can't get the words out. Citalopram, but I've just took me on a trip to leave, and it was working for this person, and then they came out with these loads of hives. It almost looks like, you know, when someone gets pricked by nettles. So yeah, it's not just the hives; it gets itchy as well, doesn't it? So, yeah, no, that's not my side effect really, mate. Most of my side effects through antibiotics have been, let me think back to it. I did get a really bad outbreak of something that you could call like hives. I went red like a lobster, and it was my partner who spotted it at first. She come into the hospital and said, something's not right with you, you're very red. And it was getting worse and worse. I had to get, you know, like a brush for your hair, and I had to brush my back. I had to go in the shower, get the cold water on, and then I was getting pumped with antihistamines, and they just stopped that antibiotic. I forgot the name, clotrazepam. I can't remember it. We spoke about it the other day. just, just weird. You said about itchy feeling because there's a weird rash in the UK. Yeah, I don't think it's. I thought it was borderline. What's it called now? That condition, skin condition. Oh, what is it? Someone help me out. A lot of people have it in the UK. A lot of people have it in general. I forgot the name of it. It's where the skin goes all red. Red anyway. I thought I had some kind of that problem. Um, no, it's not eczema, mate. It's close to eczema though. It's not eczema. Psoriasis. Psoriasis. Like I say, I used to be very red. I was embarrassed at some point parts to go to the barber because when they shaved the head, you can see the irritation on the sides, and you know, asking personal questions, and you know it's not contagious. You know it's just some kind of reaction to medication or something you've ate or whatever. But yeah, spoke to my doctor about it. Spoke to my specialist. I sent him photographs of when, say for instance, I'd be itching around the beard, and you could see. I had to. Sometimes it gets that bad. I have to shave. I have to completely shave this, and then you can see the redness. Yeah, you can see all the redness after it, just to let it breathe. Is it a kind of a tumour? Is what kind of a tumour, mate? I don't know what you mean, Mohammed. But yeah, we're all good. We got the thick jacket on tonight, if you're wondering. I've came up late. I've not had the fire on, so I've just put it on. We had the window open to air the room out, so it wasn't as cold as yesterday. Yesterday was very, very cold. Um, so I had to get up bright and early tomorrow, guys. I have to get up bright and early for the nurses. And knowing my luck, I'll be up about 7, 8 o'clock, and they won't come till 10:30. But you know what? I can just be happy I'm at home, and I just hope that they don't cut these what do you call them? I won't call them privileges, but you know, necessities, necessities of life. I just hope that, you know, the NHS can pull through and carry on giving the patients what they need, because people like me, people like my partner, people with cystic fibrosis, you get that kind of picture. If we go into hospital now to treat, you know, something that's a minor infection, not a major infection, we run the risk of catching all sorts of crap in the middle that could potentially kill us. So the method of the madness is to get us treated at home in our own, you know, privacy of our own home, which makes everything run that little bit better and with less risk being in hospital. So yeah, it's crazy what the doctors and all the hospital staff have to put up with at the moment. To be honest, mate, I take my hat off to them because, you know, they're underpaid, they're overworked, and you know, it's not their fault. So when you come into a problem, you know, they're the first. What's the word for it? They're the first person that's going to meet them words. It's not going to be the specialist. It's not going to be a doctor. It's going to be the nurses. But yeah, It's not the NHS of 5 years ago. Anyway, the NHS of 5 years ago ran a lot smoother than this. It seems to be that they can't keep any criteria and keep it based in that criteria of work. It seems that all nurses now have to do different kinds of jobs, and then get back to the IV patients, go back to the people with, say for instance, an infection in the leg. So the back and forth. Whereas if they kept them all based in certain areas or fields, that everything would run so much smoother, because they would know that today I've got 8 IV patients I need to see. So that means I need to, most patients will be on the same medication. So it's less thinking work for the nurses. Now these nurses need to travel to me, give me my medication, and then go to the next person who may be completely different to, what she's just done at my house. So they're just giving them too much work. And what you find out is, compared to say 5 years ago, people stayed in the job a lot longer. They'd be there for the full time of me being on. I think it's my 3rd year, maybe 4th year, I've been on IV medication. And what I started seeing once they started changing this program they had going that was working, and they changed it and they merged it into Northern Care Alliance. People were in the job for all of 5 minutes, so to speak, maybe a year at best, and people were then going to get visas to go and work in Spain. People were moving away to Italy. Now I can only think 2 reasons: underpaid, the taxes are ridiculous, and they're overworked. And structurally, if that's a word, it's going to pot. That's it. It's like going to see a doctor these days. It's not like years ago where you go see the doctor and the doctor would look at you, pay close attention to you, what you're looking like. Now it's just they sit at a computer and the knowledge is very weak compared to years ago when they used to flick through books, flick through files. You go and speak to these doctors and you've got 5 to 10 minutes maximum, and then you're gone. And then you think you leave scratching your head thinking, is this doctor qualified enough to be giving it this kind of information out? Is he going to miss something? I never used to think that years ago. When I used to see my doctor, I thought, yeah, spot on. Now I'm like, I don't know. Do I have to tell him? Do I have to pull out my phone and says, well, Google says this, Google says that? Because I had to do it in the past. Before I go touch on the story. So I suffered with me at the time. I didn't know what it was, and we'll call it. I suffered with abdominal pain. When I went to the toilet, I was urinating blood, so I didn't know what it was. So I kept telling my doctor this and that. Anyway, for about a year or two, nothing. Just kept continuing with the same kind of symptom. Then I read online a couple of things, and it started saying, "Does it hurt when you sit down?" Things like that. And then I fell into something called prostatitis, which is inflamed prostrate gland, right? So when I went to see the doctor, I said, I think it's prostatitis. And then we found out, but I tell a little bit of a lie there. When I presented to A&E, seeing this Indian doctor, and he was the first one to see me after I said I was just going for a walk. I had this urge that I needed to go to the toilet kind of thing. I said, when I come in, instead of urinating normal, I was urinating blood. So he said, it could be something to do with the prostrate. So that's when I started Googling things, but it took a year from seeing that doctor in A&E to seeing my GP, who was a very young doctor. He inherited his dad's business when he died. So he probably got, a couple of shortcuts to get inside the job. And I had to tell him I think it's prostatitis, and that's when I got a urologist and things like that, and that's when I got a diagnosis. So lucky for me, they found it, but by the time they found it, I've already really had the problem for about a year or two, so some damage was done. But I'm lucky in the sense that because I have the chest condition, which treats, the infection, that since I've been on the home IV medication, it's treated the prostrate problem as well. So maybe I'm just a lucky boy. But on that note, guys, I'm gonna go try and get some sleep. Catch you later. Take care.